Good morning, good afternoon, good evening, everyone. I'm Jon Stine. I'm Executive Director of the Open Voice Network, and welcome to this breakout session here in the Voice Summit 21. Today's topic that I'm joined by two very esteemed colleagues is about voice in healthcare. Voice from a patient outcome perspective, from a value proposition perspective, and most of all, from a privacy perspective. Again, I said I'm Jon Stine, Executive Director of the Open Voice Network, and we are very proud to be sponsoring this session because the Open Voice Network is a nonprofit industry association, open source community of the Linux Foundation, and our job is to be studying and researching not only the standards that may be enabling the future of voice assistants, but also taking a very hard look at the privacy and ethical concerns that again will bring user trust in the future of voice. And so with that, if you have questions about the Open Voice Network, feel free to reach out to me, but that's not the purpose of this conversation. It's about healthcare and patients and value propositions and most of all, privacy. And two colleagues with me today, on my left, Brenda, Leong, and Brenda, thank you for your time. And joining us today, Senior Counsel, Director of AAI and Ethics at the Future of Privacy Forum. An Air Force veteran, counsel, lawyer, someone researching where it's going and why in the future of privacy, AI, and the thousands of questions that all that brings up. And to her left, Harry Pappas, CEO of the Intelligent Health Association, for many, many years, working whether it's in RFID or broad technologies or just the technologies of health, wellness, and life sciences. The Intelligent Health Association has been bringing new ideas of how technology can be improving patient outcomes as well as clinician efficiencies and overall value in health. So Brenda, Harry, thank you. Thanks for joining us.
Thank you, John, for inviting us.
Pleasure. We're going to start by just, it's an easy softball question, but let's just start by the general question of voice in healthcare. Now, everyone's going to say, well, yes, of course, it's going to be very important, but I think the big question, and Harry, I'll start with you, and then Brenda, from your perspective, the question is why? Why would voice technology, broadly stated, from IVRs to voice assistants, why will that be useful, not just in the health industry, but in bettering patient outcomes? Harry, start with you, and then Brenda.
Right. Well, John, thank you. I got started with voice about 4 years ago, just to give you a little bit of background. I'm a technology geek and have been my whole life. I was visiting with my son and his wife and a newborn, and I saw this round object sitting on a counter, and my son says, I won't even mention the brand, well, maybe I will, Alexa, play X. And then instantly it's playing the Beatles. Then my daughter-in-law interrupts and says, Alexa, order X. And all of a sudden I was frozen in my chair and I said, what is that? He says, it's some new device Amazon's pushing. I said, what technology is it? He said, I don't know, it's technology. Well, guess what? From that day to this day, I've been immersed in voice. And I don't know, how many of you are in healthcare? Anybody else? Assisted living, nursing homes? No? What do you do in healthcare? Oh, perfect, the ER.
You guys, you want to sit up here close?
You guys are perfect. So I started to look at voice, not as a commercial enterprise, e-commerce, but I started to look at it and said, wow, how would this work in a healthcare setting? How could I use this device or similar devices in the OR or the ER or labor and delivery? How can I use this in assisted living nursing homes? How can I help independent living? And how can I help my parents we migrated from Greece to the U.S. many years ago. My parents were not able to read the New York Times or the Wall Street Journal. So there was no vehicle for them to communicate in their own language. So I started looking at voice as a multilingual device, okay? And how can that multilingual device help my parents assimilate into the American culture? And then I went back to the healthcare and said, let me think about this. So about 3 years ago, I went out to a couple of friends who were able to develop skills. And the first skill we developed was for the OR. So you have a physician, he's a surgeon, he's in the OR, and he says, Alexa, set the temperature because I'm going to have a 6-hour procedure. So it ties into the HVAC system, and it now sets the temperature. The surgeon says, okay, I want to play Vivaldi for the next 6 hours, and this is what I want to listen to. And I want to date stamp, time stamp all the people coming in. What time did Nurse Nancy come in? What time did Harry come in? Were all the pieces of equipment here? And all this stuff was done manually before or with a checklist. I mean, you guys know what I'm talking about, right? So now I started to look at voice as a valuable tool that could tie into an infusion pump, where the surgeon or the nurse doesn't have to look this way or look that way. The voice device can either repeat the information or can put it up on a display monitor. And so from the OR, we moved into the ICU, we moved into labor and delivery. And then the next thing is I was involved in a project with the VA on how to use RFID and how to use smart technology and voice technology for vets coming back from the various theaters of war. And so if you have a vet who has no arms, how does he open up a refrigerator? Okay, how does he turn the cooktop? And I quickly said to my colleague, I said, why can't voice do that? Okay, so this is, without taking up all the time, but this is some of the history of how I got involved in voice and how important voice is, not just to the clinician for the clinical medical setting, but how can we use it at the local nursing home or assisted living facility? How can we help physician burnout, nurse burnout, any kind of burnout in these facilities? And so I was telling John, I was on a call the other day with a CEO of a major assisted living chain in the United States, and I said, you should be thinking about voice and putting a voice device in each of the resident rooms. He says, you mean that device that plays music? I said, it's more than just a device for music. It's a companion. It's a communications tool, okay? But I said, there are privacy issues. There are trust issues that have to be resolved. So he says, well, how do you see it applying to assisted living and nursing home? I said, well, let me tell you where the ROI is. The ROI is you have all these nurses running around because Bob over here says, turn the lights up, turn the lights down. Or hey, I want to order from the menu. So there are so many uses for voice, John, in all areas, health and wellness. And every day that I speak to people, I find out more and more uses for voice. You and I were just talking about all the privacy concerns.
Well, let me interrupt you here, if I may, and just turn to Brenda. You work across the realm of AI. You're seeing the developments in technology and the use of technology in industries.
Yeah.
You're seeing, no doubt, AI and conversational AI come to healthcare. I mean, what are your thoughts? What are you seeing thus far right now?
Well, that's a big question. So, what we're talking about here, what we're seeing with voice in this context is voice is a user interface with a computer. We moved from computers being fixed on our desks to being mobile when we got cell phones and then smartphones and then tablets. And now we're talking about not having to have a physical device in our hands at all.
Correct.
And we can interact with things that were not really ever thought of traditionally as being connected to a computer, whether it's your refrigerator or your doorbell or your radio, now a home assistant, or whatever that might be. So the fact that patience is another word for people, healthcare is another word for life, medicine is another word for a business. These are the things that are just happening all around us in every context, and the fact that we're now moving to using our voices as our user interface with computer systems is going to offer incredible opportunities and potential benefits. But it's going to need us to think carefully about the implications of it. Just like when we first developed smartphones and apps, we didn't think about mobile tracking of cell phone location data. We didn't think about, as Harry was mentioning to me earlier today, when we put EasyPass in our cars, that wasn't just going to be used to charge us for driving down the highway, but was going to track our location and feed into other systems and other data.
Tell us our speed or all these things. Yeah.
By the same token, if we start using voice as an interface in our car, which could certainly tie into healthcare, am I drunk? Am I tired? Am I high? Am I diabetic and need insulin? Am I something else that can be diagnosed from my voice or from some other aspect of my behavior interfacing with the car? All of that is again, potentially very amazing in some of the opportunities, but also potentially concerning. And again, as Harry and I were talking earlier, I think we're better prepared than we were 10 or 15 years ago to realize that and to preemptively take steps now to think, wait a minute, before we put a voice activation thing in every appliance, Amazon Web Services might go down one day, hypothetically, and maybe we can't access our home security system or our oven to turn it on to preheat or our whatever that might be. So what other options and dependencies and redundancies and protections do we want to have in these systems so that we can think about that in a little bit, in a design sense, more than we did? One of the things that I work on or have worked on for several years is facial recognition technology. Not the technology, but I work on the policy implications and the legal issues around it. And I personally see voice following very closely in the footsteps of facial recognition in terms of you can hide or discreetly place microphones just as easily as you can cameras. You can monitor people in public with microphones just as easily as you can with cameras. Cell phones have both capabilities. Right. Public areas have both capabilities, and we've seen the concern and the disputes over civil rights aspect, human rights aspects, individual autonomy, awareness and consent over uses of facial recognition, and I think we are absolutely going to see those exact
headed on that path
arguments around voice. As an identifier, as a biometric identifier, not just as a user interface of a voice-activated system. If we don't think about that now and design to prevent some of that.
One of the things that the Open Voice Network does, and here's a little advert, forgive me, is we are working to kind of head this off, to be asking these questions early. And in full transparency, Brenda and Harry are senior advisors, leaders to the Open Voice Network, and giving us their advice and their guidance as to where the issues are, the questions that should be raised, the research that should be explored. There's any number of things I can follow up here with questions, but one thing we'd like to do is, Harry, you've been talking and guiding us, and you see a tremendous opportunity for the use of voice and the value of voice in the aging in place, let's call it environment, or the aging in place issue. And I'd like you to speak to that. What does that look like? The benefits, the opportunities, who are the stakeholders? And as you do that, I'm going to be asking Brenda to be thinking about what are all the red flags, the yellow flashing lights, we should pursue that, but here are the questions. and let's talk that through, kind of a use case where we can begin exploring some of the issues and identify some of the issues that are before us. Because, again, we're thinking tremendous opportunity, but we have to approach it from a balanced, reasoned, careful, researched perspective as we do that. So, Harry, why don't you start on just aging in place? What's that about? Where are the opportunities? And then Brenda, raise your hand. Hey, whoa, wait about this.
Well, John, I do want to talk about aging in place, but I just want to tell the audience, both physical and virtual out there, that we are at an inflection point with voice. We've learned a lot about cell phones and Easy Pass and 10 other technologies that are out there. Let's use that knowledge, that learning curve for voice so that we don't get into the predicament we're in now with all these privacy issues, facial recognition, all this technology. And, what I tell everybody is that for every action is an equal opposite reaction, one of Newton's laws. And what I mean by that is that I have a smartphone. We all have a smartphone. We probably all have an Easy Pass in our vehicle. But did we know what the issues were back then? Probably not. So let's learn from what has taken place, the history, to work with voice so those issues are addressed up front. Okay? So with that then...
Tell us about, aging in place.
Yeah, aging in place.
What's the value proposition?
Okay, aging in place, well, first of all, if you have parents, grandparents, they want to stay in their home, how can voice facilitate that? Okay, number one, voice in your parents' home or grandparents' home could be that companion. Your parents, grandparents may want to listen to the news in Spanish. They may want to listen to the news in Portuguese or Greek in my case. So there's companionship, there's information. Read a book, listen to Beethoven. So the value proposition to the husband and wife in their golden years is huge. Now, there are other issues that come up if you're using the voice technology in your home to give you med management reminders. Hey, Harry, you got to take your baby aspirin, okay? Hey, Harry, you got to take your XYZ pill. That's all great technology that is available through voice, but the problem is somebody tracking that? So, for instance, there's a device out being marketed that is med management voice enabled. So you put your 10 pills, 20 pills into the device, and it reminds you, sends you a signal on your smartphone or on a TV and says, take your cardio medication. Well, if you don't take the cardio medication, guess what? The device is connected so that it sends a message to your son or daughter that your father hasn't taken the medication. Guess what else, though? The pharmaceutical industry gets involved. The payer community gets involved.
May I raise my hand now?
Oh, yeah, raise your hand, yeah.
Go ahead.
No, I'm just, you can finish your thought, but I'm going to come right back to that when we start talking about privacy.
Well, go ahead.
So that is exactly the right question, which is it can enable people to live alone. It can support autonomy and agency longer into life, and not even just for people who are aging, but for anyone who has physical needs or social emotional needs that require support. Voice as an interface can provide that capability or be a part of a system that provides that capability. But what you just mentioned is the part that people don't always think through, which is based on the way that healthcare and many of those support systems are provided today, there's likely to be an insurer. There's likely to be a provider in terms of someone in the healthcare profession. There's very possibly a government agency involved in some way. There's very possibly an independent business, whether it's a pharmaceutical business or a supplier of a piece of equipment. And then there's family. And all of those people have, are stakeholders, that lovely word, And all of them have a particular goal, and let's take as a given that none of them are acting in bad faith or evilly. They are all just acting in accordance with their own priorities and needs, many of which are entirely legitimate, but not all of which can be satisfied simultaneously. And who gets to make the call on which ones take priority, and when certain things may not be able to happen, even that the company or the insurer or the medical provider might like them to, needs to ultimately still reside in the autonomy of the person, the individual, whose system it is whose support system we're talking about.
You didn't mention the voice platform provider, who
And
could
the
also
voice
be
platform provider,
That's
one of the
correct.
private companies.
Yes.
a
that
player,
would very
another
definitely
stakeholder
be
here.
a
Yes.
player. So at what point does a person's autonomy and agency get bounded? There are a number of great papers and studies about just the interaction between adult children and aging parents, and that friction of when do you have to start to try to override your aging parents' independence because you can recognize that they are no longer capable of always making the safe decision for themselves. Whether it's not taking medication, whether it's eating, things that are not just not healthy, but very definitely detrimental to a particular condition, whether it's, not getting up and walking around when they need to, whatever that might be. And so just that dynamic is very full of tension. And it gets very philosophical very quickly when you start talking about, how much right do I have to not live well and not take care of myself and, suffer the consequences of that versus have this availability of resources and choose not to use them. And so where that data goes, the data being reflecting the aging individual's behavior and choices in my life, and who gets to make decisions based on that is very fraught with ethics and morals and all kinds of questions.
Let's just stop
Huge
for a moment
problem.
and join with us and count the number of stakeholders that you both identified in, Harry, the scenario you gave. There is the patient. There may be the children of the patient. Let's assume that there are
Correct.
living children.
Correct.
Then there will be
The primary caregiver, the payer, could be
And there could be multiples of any of these.
multiples of these.
absolutely. Yeah.
And then,
There's a pharmacy.
there's a pharmacy, there's a this, there's a that, there is the platform
Equipment,
company, the tech
equipment
companies.
yep.
So we're getting into 9, 10, 11, 12
Easy.
stakeholders just in the provision of, and I have a 98-year-old wonderful father-in-law living outside Indianapolis. I would love for him to have an aging-in-place system and not worry that every time my wife calls on a Sunday that he won't pick up the phone, because that's what's going on right now.
Yeah.
That's the only way we're going to know, is if he doesn't pick up the phone on Sunday. But, 10, 11, 12 different players, and it should be mentioned, this is going to come our way. There was a speaker yesterday that said a shortage of 90,000 physicians in the United States by 2025, and by 2035, there will be 70 million individuals in the States over 65, 80% with a chronic condition.
Yeah.
So this is coming our way.
It's huge.
Brenda, speak more about, if the patient, the person is at the center. I mean, what decision process, what ethical privacy process would you envision? What should we be thinking about? As Harry and I and others, many of you are thinking about this.
I think we should be thinking about these questions as we set up these systems. A lot of it goes into the design, and let's focus on voice, because obviously all of the things we're talking about have many privacy implications in other ways, but focusing on the voice aspects of it. What does it mean that most of the voice assistants are female voices? What kind of choice does that reflect, and why was that choice made? As things become more sophisticated and interactive, say the person's being reminded to take their medication, and say that they have to actually respond in a certain way to verify that they've taken their medication, or maybe there's some kind of connectivity between the dispenser and the system or whatever that lets somebody know they've taken it, and the person doesn't and refuses to. does the voice assistant attempt to persuade them? Does it just notify the child or the doctor or the whoever is
Could
the
be
set
both.
person that they didn't, or does it attempt to persuade them? What is a legitimate use of a persuasion?
I mean, you're suggesting, in a sense, there's some, what's the word I want to use? Some sentiment analysis that maybe you're resistant to that. You're saying, no, I'm not going to do it today.
Right.
You hear in the words, but you also hear in the tone, there is a resistance to taking the medicines. Is that, and you're suggesting, well, we got to think about that.
Sure. So, I mean, there's
part of the
legitimately a number of
problem.
design choices in the answer to that. The system could be designed to, say, give 2 reminders. And those reminders could be designed to be incredibly non-affect driven. In other words, John, you did not take your medicine yet. You're 5 minutes past, the time for your medicine. I wouldn't say I can't talk like a robot. John, you haven't taken your medicine yet. Please take your medicine and let me know that you have. And you do whatever you do, but you don't take the medicine. And then the machine, again, could say, John, it's 10 minutes past. You still haven't taken your medicine. If you don't verify that you've taken your medicine, I will be notifying your son, John Jr. And that could be considered a sort of neutral item. It's just identifying the facts, and it's telling you that it's about to take another step. Now, an alternative is, John, did you forget? Are you feeling okay? I know you usually take your medicine at this time, and it doesn't show that you've taken it. Can you please take your medicine? Maybe that doesn't seem manipulative. Maybe it's not really manipulative. But somebody literally had to write code and choose between those 2 scripts. The machine doesn't come up with it on its own. Right. It's written into the code. Somebody sat down and made a choice between those 2 scripts. And then somebody designed the voice, tone, and affect to go with them. And of course, there's an infinite number of scripts and an infinite number of affects that could be assigned to that.
That's correct.
At what point does that become concerning, or based, again, on your point, based on the knowledge of the individual that it's interacting with, that the machine is interacting with, how many design alternatives, how many menu choices are there for the child or the provider or the doctor to set, and who gets to choose about, female soft sell convincing, or, male voice, life coach style, alternative, or what is it going to use?
Harry.
Yeah. You're right on target. You are on target, because I wouldn't even mention the payer who I worked with a couple of years ago. They wanted to know if a combination of voice and med management sensors would notify the payer that the patient was supposed to be taking this cardio medication, and the data showed that the cardio patient did not take the medication for a week, and he had a relapse, went back in the hospital. And the insurance company says, well, wait a minute. You're supposed to take the medication. You didn't take the medication, and you then had a second stroke, and you're in the hospital. We're going to drop you. So there are so many implications to what's going on with not just voice, but other technologies that are bolted onto voice that really, I got to tell you, it scares me, because I don't think the U.S. government is ready to tackle these issues from what I see, okay? And when I go into a hospital, I go into a nursing home, and I can see the use of voice, but I can also see mobile devices and sensors and everything else. So I'm looking at health and wellness and life sciences from a technical, holistic standpoint, and I'm looking at all the data points. It's not just voice, but everything else that's going on, okay? And the patient, the aging in place population, they don't know the issues. If your cardiologist said to you, hey, by the way, you need to use this cardiovascular exercise machine, and you need to be on it 3 times a day for 30 minutes. Well, guess what? How many have seen the ads for Peloton? Okay, guess what? It's collecting data, folks. It's collecting data. And now the cardiology community is saying, well, wait a minute, can we tap into that data? Because what's happening is, and it's a whole other project, there's this thing called digital therapeutics. I'm sure you're aware of it, where the doctor can now prescribe an app, he can prescribe a piece of equipment, he can prescribe voice device, he can provide medication. So it's this holistic blend of a digital prescription, okay, digital wearables. The doctor says, you need a Fitbit. Well, guess what? Fitbit loves it because Medicare will pay for you're shaking your head, yes, you know what's going on. So we're looking at voice, but we're also looking at how do we educate the end user to address those questions? How are we doing all this? And so I think part of our mission, John, is to help educate all these folks to be aware of that and to raise those questions.
I don't disagree with that, Harry, but that puts way too much of the burden on the individual user. Let me ask you about how detailed your knowledge is of slaughterhouse procedure and food safety. And when you go to buy a pack of hamburger in the grocery store,
don't go there.
do you actually know what rules are in place as to the health of the animal that was required and the level of the refrigeration on the truck get transferred in and the number of layers of cellophane that's required to be around it? Or do you just assume that because it's a package of hamburger in a legitimate, established grocery store, that you can trust it and eat it safely? And you could be wrong. Obviously, food has been tainted.
Recalls, yeah.
But overall, our food safety system, based on regulatory guidance of minimum standards and thresholds with some level of inspection, and believe me, I'm not here to defend that everything is perfect about these systems, but if you compare what we have now to, say, 100 years ago, when these things were first being developed, safety standards in factories, safety standards in stores, safety standards in transportation, minimum standards of compliance for processing, we've come a long way, and we can generally trust that the hamburger in the grocery store is safe. We have to take that same approach to data governance and internet privacy. We cannot assume that individual people can or should need to be educated to the point of needing to even, like you and I just sat here and didn't even come up with a comprehensive list of who even the stakeholders were in this one very minor scenario. Nobody's going to understand that. I don't understand it. You don't understand it. We have to be able to put in place some sort of framework that says there are some minimum standards. If I collect your data to charge you for driving on a road, I don't get to sell that data to somebody else unless or until there are other things in place, and that is generally understood. In the same way that we have, and again, don't please overstate what I'm saying, not suggesting that the internet needs to necessarily be a public utility, but in the same way that we monitor energy and telecoms and things like that, because they provide infrastructure, social and physical infrastructure, this is where we are now. And I think yesterday's outage, the WhatsApp outage in October, things like that, demonstrate the impact that this has on us economically, physically, practically, medically, that the impact that these things can have. And we need to have regulatory frameworks in place that bound those things and at least put some outer guidance and some thresholds and some floors in place. Then there's always going to be health data is more sensitive. It probably needs its own category. Financial data is going to need its own category. Educational data may need special protections, especially when it's for under 18 people that are under 18. So, it's not the end of the story, but I think it's an important starting point.
But we're perhaps the beginning of the story. To your point, it's the beginning of the story. And one of the perhaps higher level takeaways before we move to some questions or some other comments is one can't just say privacy, one can't just say data governance and management, one can't just say ethics. They interweave, they overlap. This is a Venn diagram, and as any voice developers are looking at working in this space, one has to go careful step by step and looking at the use of data. What data? How is it used? Where does it go? And then and as you brought up the ethical questions, Brenda, of why is the voice this way? Is it manipulative or to what degree?
And that's why I want to go back and add designers into your list of Venn diagrams, because we see too often a sort of schism between the people building and designing these systems, and again, no implication of bad faith or bad intentions implied, but who are focused on functionality and efficiency and a various set of metrics
sure.
that they're graded on and scored on, and not necessarily thinking about ripple effects and long-term ethical impacts of the choices they make, and trying to bring those two worlds together. There are computer science programs that are now starting to include ethics classes as required part of the curriculum, and there are various data science courses that are starting to more carefully include. I don't want to say that these builders haven't always been aware of bias in data and data sets, because of course they have, but
Sure.
More aware of it in terms of the long-term implication and the second-order impacts of those as we become more aware of that. If they really had been aware of them in the sense of understanding those sorts of impacts, we wouldn't have had all these stories over the last few years about facial recognition systems not working well on non-male, non-white faces. But we did. And so the point is, these people need to be also part of this conversation.
Correct.
In terms of how to get things done that we're going to then at the end, and not the end of the story, but like the end of the product development, be able to say, okay, we took those things into account and we didn't end up with this sort of embarrassing flaw in the fact that this doesn't work for some really significant percentage of our, or even a small significant portion of our population. For voice, there are people who have no voice. So even voice-activated systems, for all that they open it up to many
Are still not.
people,
They're
we
not
need
open.
to remember that there are people who will not be able to use that, whether because maybe their language isn't yet included, or their accent's not yet well understood, or because they don't have clear speech because of an injury or other issue, or because they have no speech. They also need access, and they also need to be considered in the design choices that are being made.
I regret that we're going to have to go to questions, because I think we could be speaking for 2 weeks uninterrupted. Harry, you had a final point you wanted to make.
What I want to say to everybody is, and everything you said resonates 1,000,000%, okay? The thing we got to recognize that through Open Voice Network, we can set the rules of engagement. We can educate the consumer so the consumer understands what the issues are. And I agree with you that as each of these devices comes out, and believe me, what I see, okay, is that you're going to have the big box guys, you're going to have the major hospital chains, they're all going to have their own devices out there because they want to control the relationship with their customer. They don't want Google owning that relationship. So it's now the time, John, for organizations like Open Voice Network to educate the consumer, work with the developer community, work with the designers, psychologists, psychiatrists, because it's the way you got to shape the message and the platform. So work with us, okay? Open Voice Network is here to set the stage, to facilitate, and to address these issues.
And it's one of the reasons why the Open Voice Network has our working relationship with Harry and Brenda, why Owita Coleman, who's here in the room, here in the front, leads our ethical use task force and is asking these kind of questions. And then we also have just set up, final advertisement, I promise, of a health, wellness, and life sciences community for those of you who are working in voice in healthcare. Gentlemen, the opportunity to be connecting with peers and exploring the value propositions and the issues of voice technology in healthcare. We've got 5 minutes left. Questions, comments, please, and then we'll wrap up. But thank you so much for being here.
Wow, they absorbed all this knowledge.
Either that or we stunned them into silence, one of the two.
I want to, while people
Brenda,
are thinking,
please.
maybe let me add one thought. I feel like in some ways we've felt a little bit negative and focused on some of the concerns, and they're very real, and I think we need to focus on them and take them seriously. But I do want to emphasize that there are so many opportunities offered by this, and we talked about the in-home scenario, which again I think offers tremendous opportunities for people to keep their agency and autonomy longer. I also think there's just tremendous opportunities in a healthcare facility, whether it's a hospital or other things that are just almost beyond belief in terms of the efficiencies and the effectiveness that they could add for things. there's something called ambient charting, which is when a doctor is interviewing a patient in a consultation, and the system is recording and extracting information from the conversation and putting that directly into the patient's medical record. It's an early development stage. This is not something that's in common use, but the idea that that can happen in real time. The doctor doesn't have to sit down and type it in later, or even dictate it in, even if there was a voice system later. It doesn't have to rely on the doctor's scribbled notes that she's made or that she remembers from the consultation. Is just overwhelming, and the transition to electronic health records has not been smooth. I totally understand that, but nevertheless, it is happening, and to whatever extent we can make those more accurate, more interoperable, and more effective across providers and across facilities, and more
Amen.
based on the patient's actual experience and input, I think is just really offers tremendous opportunities.
Absolutely.
So I just want to leave with that there are a lot of really cool things that could happen from this technology.
It's an exciting prospect that one has to be approached with a maturity of
Exactly.
understanding.
Exactly.
Yes, please.
Do you think it's fair to say that regulation is necessary in order to overcome the trust gap with users?
And I'll repeat that question so you can all hear and make sure that I'm accurate. Do you believe that regulation is necessary to close the trust gap with users? Is that fairly said?
I think regulation is necessary whether there's a trust gap or not. I think regulation is necessary.
Total.
And then a follow-up question. Given the, let's take that as an example. In healthcare, there's an immense cost burden, at least in America, with regards to just the whole supply chain, but HIPAA is a part of that conversation. Do we think that regulation of voice is going to, what's the degree of impact on cost?
Given the cost implications of compliance and other regulation, what would be the cost implications, again, of regulation to whatever degree on voice?
I personally would prefer to see regulation of not written specifically to technology. So not so much specific to voice as specific to data or privacy, or more broadly, in other words, where that could then be added onto in specific contexts. But yes, there is always a regulatory cost for compliance. I don't know that it will be any higher than the costs of uncertainty and inoperability and lack of standardization that we have now. But those are certainly important questions as a regulatory process would proceed.
I would add, one wonders the cost of, how many, 41 different statewide privacy
Laws? Well, so where the regulation comes from is certainly important. Right now it's active at the state level. I, of course, am implying, which I didn't state yet, that it needs to happen at the federal level in the U.S., and maybe even needs to happen at the international level in terms of coordination between countries in some of the same ways that we do for telecom and finance. So, yeah.
Hope springs eternal, yes.
What's the alternative?
Other questions? Awita.
I have a question. So, education is a big part, right, in training in terms of these issues. If you were going to add an addendum to the Hippocratic Oath, which is respect privacy. So, if you were going to add an addendum to how do you respect the rights of patients, what would you add to that?
If Brenda was going to write an addendum to the Hippocratic Oath about respecting rights of privacy and or data, what would she say? What would she do?
I don't honestly even know what all is in the Hippocratic Oath other than this sort of do no harm aspect of it. Ask the doctors in the room. Respecting someone's privacy is a great general value statement that probably
Correct.
most of us agree on. The
Correct.
devil is in the details. What does that mean? Do no harm is not an uncontroversial statement, as has been used as an example many times. You do surgery on someone, you're harming them, but you're harming them in the cause of a greater help. You know, I'm gathering your data and I'm using it. Maybe that's in some way a harm, but it's certainly at least at the first level of magnitude in effort to provide you a service or a function that you theoretically asked for. You put the device in your home or you set it up or whatever. At what second order effect, you know, is the use of that data harming you? And at what point is the balance of more harm versus less benefit tip the scale? And many people are going to make that call at different points. That's not an objectively measurable choice.
Very well said. Very well said.
Please join me in thanking Brenda and Harry, and just thank you all for being here.